Hi, everyone. Welcome to Urban Renal Talk with Tamika and Steve. Today, Steve is not here with me today. He's actually he's out. I guess he's doing what I did. Took a little time off. I don't know, but we'd like to welcome our guest, Danielle.
Hi.
Danielle is joining us from Portland, Oregon. Danielle's going to tell a little bit about her story. And if you guys have questions or comments, please put them below and we'll address them. Thank you. Hi, Danielle. How are you?
Hi, I'm good. How are you?
Great, great, great. So, you want to tell people a little bit about your story?
Okay. Um, well, I guess it started when I was born. I was born with bilateral reflex disease. However, we were completely unaware of it when I was a baby. Um, I used to get chronic UTIs all the time when I was little. So my grandma kept taking me to the doctor, and they just kept giving me antibiotics over and over again. And I guess what I recently just found out is they actually found out that I had bilateral reflux when I was 4, but the specialist didn't want to do surgery. She told my grandma that they would just put me on medication and that would fix it. But knowing what I know now, there's no way to fix reflux without surgery. But
Right.
so we did the medicine and it never worked, and I constantly had UTIs and was in pain when I was little. And it wasn't until I was 12 it kept going on, and my mom finally took me to a different specialist, and they did all their tests and they said, no, she has reflux, we need to do surgery, and we need to do it as soon as possible.
Mhm.
So we did surgery, and then that fixed the reflux, but the damage was already done, and my kidneys were left functioning at about 15%. um, so the doctor told my mom that at that point the only way I was going to survive was if I had a transplant. So we lived in California at the time of all this. So my mom researched hospitals and found like OHSU, which is a really good hospital. So she decided to move us up to Oregon so I could have people be tested and have the surgery.
Mhm.
So when I was 15, I had 3 people be tested: my mom, my grandma, and a family friend of ours were all tested, and they all came back as matches. And my grandma decided that she was going to be the one to donate since she was the oldest, and she could do it then. She was healthy, and it was, she just really wanted to do it. She felt the need that she needed to do that. So they said okay, and we went ahead with the surgery, and we had the transplant, and everything was good. I recovered good. My grandma recovered. um, I actually got out of the hospital bed before she did, and I went and walked down and saw her when she was still recovering. But everything was really good. My numbers were stable, and then around around 2011, I want to say, I started to have rejection. Um, and they didn't know why. They tried changing my medications. They tried changing my diet. We tried doing all this stuff, and they said nothing's working. So they decided to do plasmapheresis, where they put a catheter in me, which was connected to an artery by my heart, I guess. And they used that to filter the plasma in my blood and give me new plasma. And I had a series of those treatments for several weeks. And then finally, it looked like the rejection was gone and my kidney was getting better. So they realized that it was basically attacking itself. The antibodies or whatever were attacking the kidney.
Mhm.
So after that, then I became pregnant with my now oldest son. And then in 2012, he was born. Um, And then I've been pretty healthy since then. I've had regular biopsies and tests, and everything's been good. But over the years, and now I've had 3 kids, so
Right.
my levels have just gradually gone up. But they've always been stable. It was never like a large jump or anything.
Right.
But when I was recently pregnant with my daughter, she was born in 2016. The doctor told me that my numbers were going up, and if they got past 3, then he would start to be concerned that I was rejecting and that I could potentially lose the kidney. And now, when I was pregnant, my numbers were better because I had more fluid in my body.
Right.
And so I guess that makes your numbers go down. But once my daughter was born, I got high blood pressure again. I had to stay in the hospital for several days, and for them to try and get my kidney function to go back down.
Mm-hmm.
And they couldn't get it to go back down to what it was before I was pregnant with her, but they got it stable. And it was at about 3.4,
Okay.
I want to say. And so ever since then, ever since I had her, it's just been slowly creeping up. And so my doctor said it's rejecting now, and we don't know how soon it's going to reject. It could take time. There's really no way to tell. So he just has me get labs done every 3 weeks to check it and keep an eye on it. So right now my levels are at a 4 point, I believe you said 4.3, getting close to 4.4, I believe. And he hasn't told me at what point when he wants to do dialysis, so I have no idea. But I have a fistula in my arm that I got put there in like the end of June or July, and so it's fully healed now. The doctor says it's good to go if I need to use it. But right now he just says it's slowly creeping up, so he just keeps telling me to wait, I guess, and I don't really know what lies ahead or how far or time frame or anything. But I am on the transplant wait list now. I got waitlisted in September, and I've had a few people be tested to donate. 2 of them are still going through the process. 2 other people were told that they couldn't because one had kidney stones and the other one had gestational diabetes when she was pregnant. So we're just waiting for the other 2 to finish their testing process. But the doctor said that my antibody level is so high right now that I only have roughly like a 30% chance of matching with somebody.
Okay. So instead of him telling you, why don't you just ask him? Like, ask him at what number do you put someone on dialysis? That way you could kind of prepare yourself that, okay, it's 4.4, whatever. I know that at 5.3, you get what I'm saying? Like,
Yeah.
don't wait for them because they'll tell you the day of, and then it'll be a shock to your system.
Yeah.
Versus you asking them the questions because they're not going to voluntarily tell you anything until it's that day of, like, oh, I think it's time for you to go on dialysis. In a case like this, you need to be your own advocate and ask questions.
Yeah.
Like, what is the process after this? What is the numbers that you look for to put someone on dialysis? What center will I go to? Can I find my own center? You
Yeah.
know, just so you could kind of prepare yourself versus
Yeah.
him preparing you.
Yeah. I tried to ask him when he thinks I would need to do dialysis, and he tells me that it's hard for him to say, that he doesn't know because he can't predict what's going to happen. But I have an appointment coming up with him, and I was going to ask him what exact number should I be
Right.
getting concerned about,
Right.
because that's just kind of random, and it's like it's stressful not knowing what when I'm gonna have to go.
Right. And then you're a mom of three. So it's like, okay, I have to find someone to watch them,
Yeah.
while I go through this process.
Yeah.
So which shift am I going to have? I need to find somewhere that's flexible. Can I do it at home? So it's a lot of different things that you need to know or you want to know with this process here. So
Yeah.
I will ask them. I will
Yeah.
ask
And I've asked him about doing it at home because at first he was really pushing about me going to a center,
them.
because he said he's worried about my kids being around. He doesn't want them to like touch the machine or do something like that or mess with anything they're not supposed to.
Right.
But I've been asking him if it's at all possible for me to do it at home because I feel more comfortable at home, and I could
Right.
just come in my room and do it while my kids are in the other room.
Right. Right. So
But
yeah, keep keep pressing him because this is your life. Though he wants you to do it in a outpatient setting, keep pressing him that you prefer to do it at home versus in center.
yeah,
That is your option.
yeah.
So you have to know your rights. Steve is joining us. Hi, Steve.
What's going on, guys? How you doing, Danielle?
Hi, I'm doing good. How are you?
All right, all right. Pleasure to meet you. What's going on, Mika?
I'm good. It's weird. I feel a little nervous being on here by myself. I haven't done this in a minute, so
Oh,
it's a little
yeah.
rusty.
I saw you. You look like you need a little help. So I said, let me log on from Florida.
Yeah, thank you. I told her, I said, listen, I may be a little nervous. It's been a minute since I've been doing this, so, but yeah.
No, absolutely. I understand. I understand. I'm using my phone, but yeah,
Okay.
Danielle, I was hearing your story, and very, very interesting. So you haven't started dialysis yet.
No, not yet.
That's good. And let's hope you don't even have to start. What I wanted to know, have you experienced any of the symptoms of kidney disease, like swelling or the metallic taste in your mouth, or itching, or shortness of breath?
I sometimes my hands are swollen a little bit when I wake up in the morning. That's really the only swelling that I've noticed. The main symptom that I have, which I'm also severely anemic, so my doctor says it's from that. But the main symptom that I have is I'm extremely, extremely tired all the time. Like I never have any energy. And I understand I have 3 kids, which they make me tired. But I can tell that I have drastically low amount of energy than I used to have.
Mm-hmm. Did they tell you why that you're anemic? Did they give you like the explanation on what caused the anemia?
No, I know it runs in my family. My grandmother is also severely anemic, but they've never told me why. I mean, I've had iron infusions, and I get sent to go get Aranesp
Mm,
injections all the time,
right.
to try and boost my blood count, but it always falls back down.
So let me just give you the reason why that you're anemic. So with the kidneys, they produce a hormone called erythropoietin.
Mm-hmm.
So that hormone is released from the kidneys and it goes to the bone marrow and it signals the bone marrow to produce more red blood cells. Now, when your kidneys fail, it stops making that hormone, so it stops sending that hormone to the um, bone marrow. So the bone marrow is not producing more red blood cells. And so that's where the kidney disease anemia comes in. Now, if you was anemic before kidney disease, I can't tell you the reason why of that. But with people with kidney disease, because of that hormone, the kidney is not releasing that hormone, erythropoietin, and so it's not stimulating the bone marrow to produce more red blood cells. And Aranesp is just a man-made synthetic drug, just like Epogen. and it does the same thing that the erythropoietin would do if the kidneys was releasing it. So
Mm-hmm.
now the kidneys are not releasing that hormone; it's being given to you man-made synthetically, so it can do that job that the kidneys once did.
Gotcha. That makes sense.
So
Yeah.
when you first got your transplant, were you always tired, or this is something new? Like, are you noticing that you're just more tired recently?
When I first, before I got my transplant, I noticed that I was kind of tired, but at the same time, I mean, I was a teenager and I had like tons of energy. But my mom and all of my family used to always ask if I felt okay, if I was okay, because they said I look sick all the time. Because, like, well, I'm super white for one, but I have dark circles under my eyes that are like super super dark, that if I don't wear makeup, everybody asks me if I'm sick, if I'm okay, like all the time. So
Right. Okay.
Wow. Danielle, how did you meet Adrian?
I met him through Facebook. My fiance had posted a thing just asking people to kind of pass it around, letting them know that I needed a transplant if they knew anybody. And some lady who was a mutual friend ended up tagging him and asking if he could help out in any way. And so he sent my fiance a request and me one, and then we just started talking and got to know each other.
Mm-hmm. Mm-hmm. Now, before you met Adrian, did you know much about this kidney disease community?
No, I haven't really been in touch with like any kidney thing going on. I mean, I've talked to my doctors and asked them about things, but they don't know about anything. So,
No.
They don't want to answer.
Okay. On Facebook, did you know that there was a whole kidney uh, on social media? Were you aware of that before you
no. No, I wasn't aware that. I was actually shocked when I was scrolling through your page that you have, the couple of your pages that you have about the kidney stuff, and I was like, wow, like there's a lot of people talking about kidney disease, and I've never talked with anybody about kidney disease before, so it was really interesting to me.
Wow. So the doctors never encourage you to like read up on it or anything like that?
I mean,
She
I've
disappeared,
read up on it and I've done like research on my own and stuff like
Tamika.
that.
Yes.
She dropped off. Hopefully she'll come back on.
Oh, no, she's still on.
Oh, okay. Okay. Dropped off my screen.
Yeah, maybe your screen. She's still here.
Okay. Okay. Go ahead. I'm sorry.
No, you're fine. No, I was aware, like I read up on it and stuff, but I didn't know that there were like social media groups or like anybody like talking about it online and talking about it with other people and stuff. I've never
Right.
really talked to people about it.
Oh, wow. Well, now you have a whole community out there that you can talk to, which is very therapeutic. When you have people that's been where you are or in the same journey as you, is very, very therapeutic.
Yeah. And like
Yeah.
I talked to that woman just the other day who has been on here, and she's been on dialysis for, I think she said like 28 years or something.
Hmm.
And I was talking to her, and the reason why she has kidney failure is because she had bilateral reflux, or the same thing I had. And I was
Right.
like, that's crazy. I've never talked to anybody who's had the same thing as me before. So it was really interesting.
Yeah, I have a cousin. She didn't have bilateral reflex, but she suffered from UTIs a lot.
Hmm.
And the medicine wind up shutting down her kidneys. I think the medicine was called Bactrim
Oh, yeah.
and wind up shutting down her kidneys.
Hmm.
And I was like, wow. So it's like you hear kidney disease and you hear different people's story of how they got it. And it's just all different stories. Like sometimes one story is not like the other story. It's so amazing. Like all
Yeah.
these different people with different stories, but they all end up with kidney disease. It's so weird. And
Yeah.
then no one really wants to talk about it. So it's like you're in the dark with it.
Yeah,
So
exactly.
you talk to your children about you having what's going on, that you have a kidney in you and it's rejecting?
Well, they don't really quite understand. They know that like I have to go to the doctor a lot and stuff, and they ask me, like my oldest mainly, he gets upset every time I have to go to the doctor.
Hmm.
Um, so he doesn't really understand. I've tried explaining it to him, but he just understands that mommy's sick. And
Right.
so every time I have to go to the doctor because I have to give them blood or I have to have my checkups and things like that, he gets super upset and he's like, "No, mom, you can't go to the doctor." And I'm like, "I'm sorry, but I have to." Like,
Right.
it has to
Have you
be
ever
done.
taken have you ever taken him with you?
No, I haven't. He has a tendency to try and like run away from me. So
Okay.
whenever we're in like public settings, I don't know why he does it. He listens to his dad just fine, but when it's with me, he tries to run. So
Okay.
he makes it
So,
really difficult.
so for the viewers out there that don't know with bilateral reflexes, do you mind sharing with them what it is?
Yeah. So bilateral reflex is basically when, well, for my case anyways, I don't know if this is for all cases, but for my case it's where you have little valves on top of your ureters that open and close. And they open to let the urine pass from the kidneys into the bladder. And they close after the urine passes through so it doesn't go back into the kidneys. But with mine, the valves on my ureters were stuck open. So all of the urine was going back up into my kidneys and causing damage. So that's what led to the damage. So they had to go do the surgery. They had to make it so the flaps would open and close again like they're supposed to.
Wow. Okay. Oof. And how old was you when you had this surgery?
I was 12 when I had that surgery. That was in 2003.
And with this whole process of you being young, did you understand what you were going through?
When I was younger, I didn't understand it. I just knew that it, like, I was told that I had to have surgery, and I was told that I was really sick, and there were certain things that I needed to do to get better. And my mom would sit around, and she was always crying all the time, and I never knew why. I never knew what was going on. It just didn't. I didn't understand because I was so young.
Right.
But as I got older, I started to realize how serious it is. And like, I have to take my medication, I have to take them at the same exact time every day, every night, and drink tons and tons of water, and watch what I eat and watch what I drink and everything else. And so I try now to be really healthy. I try to eat healthy and drink a lot of water and all that good stuff. But when I was a teenager, I was definitely difficult with it because I had to take so many medications and I was tired of taking them. And my mom was always on me, like, drink your water, take your pills all the time. So now it's just kind of like ingrained into me, like I have to do it. But
Wow. So, do you think that I'm sorry. Do
Danielle,
you yes? I'm sorry. Uh, do you think that if there was a children's book
hello,
for yes, Steve, we can hear you.
Danielle.
Yes, Danielle can hear you too.
yeah.
Tamika froze up, but we'll keep it going. Do you think they understand your disease?
Could you hear him, Danielle?
No,
No. You
He's just
sound,
broken up.
yeah, you sound like all like you have auto tunes on. Like can't really hear you that well, Steve. This is live, y'all, so y'all know anything happens when we're live. How about now, Steve? Say something. All right, I'm gonna
Oh,
take him out and then I'll let him come back up.
okay.
So, as a mother, do you think it'll be easier to talk to your children about kidney disease if it was a book? Like if you had a book to kind of teach them from?
Yeah, that's pretty interesting. Yeah, I think if it was like in a children's book format, I mean, my kids love books, so
Right.
and my oldest son definitely. So yeah, if it was in like a short little story that was easy for him to understand, then I think it would be better for him.
Right. And the reason why I asked because there's so many young people getting on dialysis or developing kidney disease and they have children and it's kind of hard to just explain to your child, oh, I have kidney disease, I have to go on dialysis. They don't really understand. And
Yeah.
it's just in my head, like, well, maybe you should write a book to
Yeah.
try to, so children can understand because there's so many people on dialysis and there's so many people with kidney disease. It's
Yeah.
like an epidemic.
Yeah. Yeah, I
Okay.
was shocked when I realized how many people have kidney disease. It was crazy.
Yes. Yes, I have a son with kidney disease. He's 19 now. And he was 18 months when he was diagnosed with nephrotic syndrome. And it was the worst. It was on Mother's Day, and my baby swelled up. And I rushed him to the hospital, and we waited 12 to 15 hours for him to urinate, and nothing came out. Nothing.
Wow.
Then they put like a catheter in him and they let him, void or whatever. And that's when they told me that he had nephrotic syndrome and sent me home and said, "Oh, you need to see a nephrologist." I didn't know what the hell was nephrotic syndrome, even though I was working in the field. I didn't know
Yeah.
what it was.
Yeah.
So I'm also like, this is a personal mission for me because I am a mother of a child that has kidney disease, and I have tons of family members that's on dialysis or has kidney disease.
Yeah.
So yeah,
Yeah,
wow.
all of my kids were they the doctors were aware of my kidney disease when I was pregnant. So through all of my pregnancies during the ultrasound, they checked all of my kids' kidneys to make sure they were flowing fine and everything was working fine. And they said everything looked great in all of my kids. So I was really thankful for that. But it's like now that they're born and that they're older, I almost want to get them tested again just because I don't want to be, years down the road and have the same thing happen that happened with me. Like, oh, we didn't catch it. Now it's too late. Now there's already damage done.
Right. Well, with your history, your doctor should have already been testing your children for it. But did they say this was hereditary?
I got it from my biological father.
Okay,
Um,
well then they should be already testing your children. If not, ask them to test them.
yeah.
Like don't be afraid to speak up and advocate. Like be on
Mhm.
them because like you said, you don't want this to come down on them later on down the line.
Yeah. Yeah,
And if you
exactly.
don't speak up for you, they're not going to do it.
Oh,
And that's
yeah.
like there's so many people with kidney disease that's thrown on the machine because the doctors have yet to really educate them. So they just
Yeah.
throw them on machines because no one's asking questions. Hi,
Yeah.
Steve.
I'm back.
Are you sure?
Yeah, I'm telling you, this technology is something else.
It's okay. You have any questions you want to ask her, Steve?
Now, what I was asking Danielle, are your children aware of your kidney disease? Like, know what's going on, or do they understand what's happening?
No, not really. My oldest is 6 and he's about to be 7. And then I also have a 4-year-old and a 3-year-old. So my 4-year-old and my 3-year-old don't really understand. My 6-year-old, he's autistic, and so what they call extroverbal. He's always talking all the time.
Mm-hmm.
So he's always full of all kinds of questions. He's always like, why are you going to the doctor? And I try to explain it to him as best I can, but he doesn't really understand. So he just understands that I'm sick and that I have to go to the doctor for them to help me be better. So, but he gets upset every time I have to go to the doctor. Whenever I go to the doctor, he has a meltdown and he's like, "No, mom, you can't go. You can't go to the doctor. They're going to poke you with needles." All this
Right.
stuff. I'm like, it's okay.
Mm-hmm.
But he
Have
doesn't fully understand.
right. Have you met anyone um, close to your age group that's doing dialysis at the moment?
No.
Mm.
No.
And you're in Grand Pass, Oregon?
I'm in Portland, actually.
Oh,
I used to
Portland.
live in Grants Pass, so it said Grants Pass on my Facebook, but I've lived in Portland for almost 4 years now.
Mm-hmm. Mm-hmm. Have you since being diagnosed with kidney disease, have you ever stepped foot in a dialysis clinic to actually see the process of kidney dialysis?
No, I've had to go to a class about it, and I had to learn about it. And then when I had um, renal failure before, I had to do plasmapheresis, and in the center where I was getting my plasmapheresis, there were also people who are on dialysis there. So I mean, I've seen it and I've been around it and I kind of know what it consists of, but I've never done it myself.
Mm-hmm. Mm-hmm. Let me ask one question. I had to go outside for a second, Tamika, but
Okay.
Danielle, what's your biggest fear this whole process?
My biggest fear, I guess, is just the fact that they told me my chances of finding a match for donating is about 30%, and they said that I could be on the wait list for on average 5 years, but they said it potentially could be longer than that. So I guess my biggest fear with that is I just don't want to be on dialysis for years and years
Right.
and years and be trying to keep up with my kids and stuff. But
Right.
I also want to be healthy for them, so I have to do what I have to do right
Absolutely.
Right.
now.
Yeah.
So
And we're going to do everything we can to, promote to get you a kidney as much as we can advertise. We're going to make sure that happens.
yeah.
Well, I appreciate it. Thank you.
Wow. So have you ever like I know you have the fistula in your arm or whatever. Did they
Mhm.
even teach you how to care for the fistula like after they placed it?
No. No, he hasn't told me anything about it.
He didn't say don't lay on it or anything.
No, he said everything is fine. He just said um don't take any like hard hits to your arm. Cuz I told him my oldest son, he has meltdowns sometimes and he gets upset, and when he gets upset, he will just kind of flail out and he'll throw his arms around and he'll grab my arm and squeeze it really hard, and
Okay.
he'll hit me and he'll bite me and all this other stuff. And
Yeah, you
I
gotta watch that.
yeah, and when he's doing that, his behavioral therapists have told me when he does that, I just have to pick him up and remove him from his situation and just put him in his room or in a quiet space where he can calm down. So a
Right.
lot of times I have to pick him up and he's pretty heavy, and he grabs my arm and he squeezes it right where my fistula is.
Yeah,
So
you have to watch.
so I constantly have to tell him, "Don't grab my arm, please. Like it's really painful." But so now he's gotten better. He's a little bit gentler with it now.
Mhm.
But because they can feel it, the kids think that it's weird. So they come up and touch my arm all the time just to feel it. But
Can you see it outside of your skin? Like, would you mind showing it?
um Yeah. Let's see. It looks like I have a really big muscle, but I really don't. It's just a
Oh,
vein.
okay. So it's in your upper part of your arm versus the
Yeah,
bottom.
it is
Okay.
right there in my arm. I don't know if you can see it
Yeah,
very
I
well.
can see it. Yeah, I can see it.
Yeah. It looks like a muscle, but it's not.
Yeah.
So
You don't
yeah,
have
it's
any
right there.
numbness or tingling
No, my
with
hand,
fingers?
yeah, in my hand and my fingers, they get very.
No.
I'll lose feeling in them, and my hand gets super cold all the time, and it
Okay.
cramps up all the
Let your
time.
doctor know. That's a sign of Still syndrome. So, do you know what Still syndrome is?
No.
Still syndrome is when your access basically is still in the blood supply to your fingers,
Mhm.
and just let them know that you have these sensations. So, even though it looks good, you
Yeah.
know, just let them know that you're having these problems because once you get on the machine, it'll get worse. So, they may tell you to put like a glove or something on,
Mhm.
but talk to your doctor about, you're having numbness and tell them, you possibly could have like Still syndrome because that's what it is because your your fistula is still in blood supply from
Yeah.
down your hand, okay?
Yeah. Yeah,
Yeah.
I told him. He asked if there was anything wrong with it, and I told him my fingers get very tingly, and if I hold something for too long, my hand will go numb. Or
Right.
like when I'm doing the dishes and stuff, my hand will cramp up, and I have to just set what I'm holding down and
Right.
let my arm relax. And he said, "Oh, that's normal. There's nothing to be worried about. That's to be expected." And I was like, oh, "Okay, well, I don't like it, but." He's like, if you have dialysis and if it bothers you and it continues to bother you, then we can just remove it and put it back. But then we'll have to do one somewhere else.
Right. But hello, if it's bothering me now, it's gonna what bother me later. Hello.
Yeah, yeah, exactly.
Wow.
I asked
So,
that lady who she's been on dialysis for 28 years. I asked
mhm,
her too if she had the same thing, and she said her hand hurt like that and her hand was tingly and stuff, and she said her fistula only lasted like 3 years and they ended up having to take it out because it made part of her heart swell or something.
mhm, mhm. She had
And I
like
was
a
like, well,
blood
that's
problem.
scary.
Yeah. Yeah, wow. If it bothers you when you're on dialysis, like her love is doing it now. Anyway, I'm sorry.
Yeah,
I just be feeling some type of way when they like push issues that could be fixed now off versus waiting for you to get on the machine and then you have another issue because you have to get the catheter because they have to remove the fistula because it's causing more problems versus handling the issue now. You have children. You can't spend days after days in the hospital, but
yeah.
don't get me
And when
started.
we moved up to Portland too, I mean, granted in Grand Stress, my fiance and I, we don't have any family on either side of us. So it's literally just us and our kids. So when anything happens and it's an emergency, I usually have to go into the hospital by myself because my fiance has to take the kids.
Right.
So,
So do you
and
see
then
my
he's stressed out.
right? You see my point about fix it now versus you
Yeah.
know, you have to give me two surgeries, one to put the catheter in and then one to fix your fistula. And you're a mom of three. You don't need that.
Yeah.
So, how are you mentally adjusting to possibly have to go on dialysis? Because that's a big one too, a mental adjustment, especially you have three children, a fiance, and no family by.
Yeah. Well, for about a couple months ago, I want to say maybe like 4 or 5 months ago, I was super depressed and I just like didn't have energy. I didn't want to do anything. I was just sad all the time. Um, because I basically felt like I couldn't do anything.
Right,
And my doctor told me that I'm not allowed to work right now. I'm not allowed to really do anything. He doesn't want me in any high stress situations. um, so I'm like, okay. And then I said, when am I going to be able to work or to do something? And he said, I don't know, you could be waiting for potentially 5 years or so. And I was like, 5 years of just not being able to work or help out my family and do stuff, it just made me feel really down, because my fiance 100% supports us and does everything that he can, but it makes me feel bad because I'm not contributing like I wish I could.
Right.
So the anticipation of like having to go on dialysis, it stresses me out, because right now, since I'm not working, I try and do everything I can at home. I try
Right.
and take care of the kids. I try and get them their school clothes, get them everything they need for school, take care of dinner, do everything like that. And knowing that I'm going to have to be on dialysis just kind of stresses me about what I'm not going to be able to do, because I'm going to be too tired, or I'm going to have to be having to do dialysis. And, there'll be certain things that probably will be harder for me to get done.
Mm-hmm.
So, and I know my kids are super attached to me. They're all mama's kids. Like, they're with me all the time. So for me to have to go and do dialysis for several hours, I know they're going to be upset that I'm not here with them.
Right. Right. Have you thought about trying to find support groups where you're at? Like, have you Googled any support groups?
I haven't. I don't really know what to search for, I guess.
Okay.
Um, I mean, it's probably something that I could probably look on Facebook or something. I don't know.
I could send you some stuff too. It's like something you don't really think about, but support groups really help. When I was pregnant, I had like three different support groups because I'm 40 and having a baby, and it's just different. So I needed as much help as possible. But there's a lot of support out there for kidney disease patients. And I'll send you some links.
Okay, yeah, that would be really cool.
Yeah, because I don't want you to get depressed or anything like that. You have to keep your strength up, especially for your children.
Yeah. Yeah,
And
I try and
depression,
stay as positive as I can. Like, I was super depressed like 4 or 5 months ago.
mhm,
And then I just started getting into the mindset of realizing, it could be worse. Things could be
right.
worse. Like, I could not be able to be here with my kids. I could, have something way worse going on with me that would make it to where I can't go out and do things with them or have fun with them or run around with them. And so every day I'm just thankful that I'm able to do what I can do with them and still be here for them and help teach them and watch them grow and all that stuff. So.
Yeah.
Hey,
But
Tamika,
yes.
um, Danielle, did the
Mm-hmm.
doctor say why he didn't want you to work?
He said because he doesn't want me dealing with any kind of stress, because I have really, really high blood pressure. And he said the more stress I take on, the more damage it's going to put on my kidney. So he doesn't want me doing anything that will cause any kind of stress or anything.
I mean,
Okay.
nothing
So
part time.
no, I asked him. I was working for a while, but I was getting really sick. It was before I found out that my kidney was failing. I was kept getting really sick, and I kept throwing up when I was at work, and I was very nauseous, and I had to go to the hospital. And after I went to the hospital, he told me, hey, so the reason why you keep getting sick is because your kidney is failing and your blood pressure is extremely high. And he's like, I don't want you to do anything. I want you to go home and you just need to take it easy and just rest. He's like, every time you get worked up, your blood pressure goes up. And when your blood pressure goes up, you get sick and you get nauseous and you throw up. And so, which that still happens to me even at home. I mean,
Thank you. I'm sorry. I was about to say that you have children, so
yes,
I think work is a little lighter than having three kids.
yes. Yeah, my son, I mean, he's autistic, but I love him to death. But sometimes he gets set in these meltdowns that he has, and he screams and he gets really upset. And sometimes it's hard for me to take on, and I get stressed out.
Right.
And then I have to take a minute to go sit down and calm down, because if I don't, I get sick and I have to throw up. And I mean, it happens frequently, but I try to control it as much as I can. Deep breathing helps a
Yeah.
lot.
Yeah. Meditation.
Yeah.
Wow. So did you tell him that you throw up also at home?
Yeah. And at first they thought that I had some like GI issue. So they put a camera down into my stomach to go look at my stomach, because they thought something was wrong. They found out that I have a hiatal hernia, but he said the hernia is caused from me throwing up. So they don't want to fix it. They don't want to do anything about the hernia because he said it's small. But they can't figure out. The only reason why he could figure out why I keep throwing up was that my blood pressure goes up and my body can't handle it.
I hear there's a whole lot of food trucks.
So
I'm not a doctor, but I don't believe everything that they say.
yeah,
It could
me
just
neither.
be it could be a part of anxiety that has you really nauseous. Because from what you told me your blood pressure was, I knew plenty of patients' blood pressure higher than that, and
Yeah.
they have a headache. And I know everyone is different. Like I said, I'm not a doctor or whatever, but I think that you could be having like some anxiety.
Yeah.
You
Yeah, I
know,
do have anxiety. I mean, I have social anxiety. I have
right?
all kinds of anxiety, but I get headaches a lot because my blood pressure goes way up and then it'll go down and then it goes back up and down. So it causes like pressure buildup in my head. But they said there's nothing they can really. They've given me every anti-nausea medication that they can, and nothing works. None of it ever works. So the best thing that I found that works, that helps with my nausea, is extreme cold and
Mm,
deep breathing.
right, right. Wow.
So
Right. I want you to really advocate for yourself, like with these doctors and stuff. Like really
mhm.
speak up for yourself. If you have any questions, don't wait for them. You ask your questions because
Yeah.
they'll wait for the last minute, and you have three small ones that you need to be here for.
Yeah.
Really advocate for yourself. Get on some of these social media groups on Facebook. I would say personally, get on the positive ones, not the
Hmm.
negative ones, because you do have some that's really negative. Try to stay amongst positive people
Yeah.
because it really helps with your aura and keeps you going.
Yeah.
Does anyone
Yeah.
have any questions out there? Let's see if anyone has any questions. Like I said, I feel kind of rusty with this, but see if anyone have any questions. I'm gonna check with there. Check and see. Have any questions? Yeah, but you have to, it's so important that you be your own advocate. Like doctors, they know some stuff, but they don't know everything. Like everyone's body's differently. So what's good for Patty may not be good for Jill. You get what I'm saying?
Yeah.
But they want to put everyone in one cluster versus looking at the individual patient, like him saying because you're throwing up means for you not to work. Well, you're a mother of three. I would rather go to work than stay home with these crazy kids running through the house. Get me to work.
I know, right?
You know, I think my job is less stressful than it is being a parent. So that right there just tells you that he just put you in one group and never looked at, but she has children also at home. So maybe it could be something else. And
Yeah.
that you do throw up at home. So maybe it's something else. Maybe it's not her pressure. Maybe it's something else.
Yeah.
Um,
Yeah, I've tried doing all kinds of things to just basically try and just figure it out for myself, because I know that he's not going to take the time to look into it or figure out what it is or anything. And I swear I've tried everything that I could think of to try, and yeah, so far the only things that work is just taking that quiet and deep breathing, and like taking an ice cold wash rag from like the freezer or something and just putting it on my head. Those are the only things that will make my nausea go away. But yeah, I'll wake up some mornings and I can just tell that my blood pressure is high as soon as I woke up, because I can just like, it's almost like you can just hear your heart beating, and like
Right.
I can tell that it's beating way too fast. And
Right.
so,
So
you know,
we have a question. Is Erin? She came in late, so she wanted to know what caused your renal failure.
um what caused it was the bilateral reflux disease, and I was born with it, but the doctors caught it when I was 4, but they didn't think to do surgery to fix it. They thought medication would fix it, which is ludicrous. But
Right.
they didn't realize until I was 12 years old that I needed to have surgery to fix it. And by that point, I only had 15% function left.
Wow. Okay. So there's someone said they was kicked out of a group. So on some of these groups, depending on which you post, you may get kicked out. But those not the groups you want to get on. You want to find the positive groups, and I'll help you find that along with the information I told you I'll give you for your son.
Okay.
So let's see if we
Yeah.
have any questions.
Yeah, for
Okay,
sure.
we have another question. When did you start dialysis? Well, you've never been on dialysis.
Yeah, I've never been on dialysis. I haven't started it yet. I'm hoping that I won't have to start it soon, because we have Christmas coming up, and then next month is all of my kids' birthdays. So I'm hoping that I at least have some good, 6 months or so left. I'm hoping. But, like we talked about earlier, I'm definitely going to call him and ask what that exact number range is where I should be concerned. So that way I know.
And then something else you could do, like I have children. I'm not on dialysis, but as a mom working a lot of hours, I used to like
Mm-hmm.
make meals and freeze them. So when he gives you a date or whatever, you could get like the casserole pans and start making some meals and freeze them. So all you have to
Mm-hmm.
do is come home and put it in the oven.
Yeah.
You know, maybe on the days you feel good, like Sunday, make about four different meals if you can, or three different meals, and
Yeah.
put it in the freezer. And all you have to do is just unfreeze it. That's just me having a bunch of children. Well, now I have five, but just
Yeah.
me working in dialysis. When I was working in dialysis, I was working from like 4:30 in the morning to like 7 at night. So I had to prepare these different type of meals, or my children would be eating takeout.
Yeah.
So,
Yeah, we luckily we're part of this program. It's the same program that does Meals on Wheels for elderly people. They also
right.
do meals for kids. So since I have 3 kids and I have a disability, every week these people bring food over, and it's frozen food. And they also bring fresh fruits for my kids and bread and things like that. And I just freeze it, and then we make it when the kids are hungry. We don't have anything to eat, so, or on nights when I'm too tired. So
All right. So we have another viewer, Michael. He says, basically, when you start dialysis for the first year, your body has to readjust to everything. It's either going to make you sick or give you a headache or something is going to go on, but the first year is always the roughest.
gotcha.
So that's when your
Yeah.
support groups come in, and some tips from other dialysis patients will come in. But we're not going to speak that into existence. We're going to find out and then go from there.
Yeah.
Okay. So
Yeah.
if it happens, it happens. But you still ask your questions and you still advocate, because no one's going to advocate for you like you. And you let them know that you know what you're talking about, and you start doing your research. So they're not the only knowledgeable person. Sorry, they're not the only knowledgeable person in that room.
Yeah. Yeah, for sure. I've definitely done a lot of research. I guess as far as like me being sick and what to expect and stuff like that. I
Mm-hmm.
haven't done too much research on dialysis. I've just heard what I've been told, but everybody always says something different. Some people
Right.
say they feel a lot better after dialysis. Some people say they
Mm-hmm.
feel worse, and
Right.
it just varies from person to person.
Right. And it will, because it's each individual going through it themselves. So no one can tell you what you're going to 100% feel like, because you may not feel like that. They could just tell you, well, this has happened to me. You know, it's just
Yeah,
they everyone is different, their body mechanics is different. So you may not cramp where someone else will, you may not feel nauseous where someone else will, you may
hmm
have your own different little side effects from dialysis, or you may not, but everyone's
yeah,
different. So sometimes just listen to people, because you never know what they say you may have to use one day. You get what I'm
yeah.
saying? So but everyone's different.
Oh yeah,
Yeah, but these groups will also help you, like, kind of deal with what you're going to walk into, if you had to go on dialysis. And then the support groups for women, I think we all need it. It helps us not to get depressed, because as women, we are more depressed than men,
hmm
especially when you have children. So I really want you to find one of these support groups and be engaged with it, so you're not falling into a hidden depression. You
yeah.
know, as mothers, we tend to hide a lot. So that's what I'm saying, like, get into one of these support groups, and try to keep your energy up, because your children need you, and
Oh
so does
yeah.
your fiance, but your kids need you too.
Yeah. No, I don't know why I've never really thought about it. I mean, I'm part of support groups for autism and for autistic parents and like things like that. But I guess when it kind of always comes to me and it comes to my health issues and stuff like that, I kind of just
Throw them on the back
push it.
burner.
Yeah, I just push it to the back and try and deal with it myself. And I don't want to put it off on anybody else. And like, I had lots of people messaging me that I'm friends with after my fiance made that post about me
Uh-huh.
needing a transplant and stuff. I had so many people message me saying, "I didn't even know that you were sick. What like tell me what's going on? How did this happen to you?" And like I never knew that anything was wrong. And I was like, "Well, I don't just. It's not something I just walk out and say, hey, like you know."
Right, but
Talk
maybe
about my
you should.
health, but
Maybe you should. And I
yeah,
just say that only because I've noticed through the years, I've watched people actually come from being scared to talk about their kidney disease to someone actually being a donor, like someone
yeah,
actually giving them a kidney from them telling their story, like what you're doing right here.
yeah,
Because you never know who's watching, you never know who's willing to help you.
yeah,
So sometimes you have to, like, put yourself out there.
yeah. And I mean, in like 100% honesty, like I was super nervous about like doing this and like talking on here. I don't think I've ever literally talked on a video ever, but my fiance was like, "You need to do this. I want you to do it because you never know who's gonna be listening, like you
Right.
said, and you never know. Like somebody could be like, hey, why don't I get tested?' And they could end up being a match.
Right.
So
Or not even that. If they hear that you're on dialysis, someone may bring you meal cards or something like that to help your
yeah,
children. Or they find out that you're not working, you may have a secret Santa. You
yeah.
know, if I was in a position to help you right now, I would send you some Walmart gift cards just for your babies, because I know how hard it is.
Oh, thank you. Means a
I know
lot to
how
me.
hard it is.
Oh yeah.
Especially around the holidays and not working. So I totally understand.
Oh yeah. Yeah, it's super difficult. I mean, we live like paycheck to paycheck. We try to save what we can. My son actually just recently started getting some social security for his disability. So I took a little bit of that and was able to use some of that to buy him some Christmas presents. So, you know,
So we have another question. Aaron wants to know, how old are you?
I am 27.
She is 27. I remember.
I always have to think about it.
I remember 27. Long time ago. So if you was to check this broadcast later, there's some people that's suggesting some groups that maybe you can
Okay.
add yourself to. And if you're ever not feeling the energy in a group, I would say for you to remove yourself, because sometimes other people energy can come onto us, and
Hmm.
you don't need that. You know,
Yeah.
you're young, you don't need that. You have children, you don't need that.
Yeah. No, for sure. And I'm a very like empathetic person, so when somebody's feeling something,
Yeah.
like I take it in and I'm, you know,
Yeah,
takes
you
up
don't
a
need to
lot of
wear
my
it.
energy.
Yes, you don't need to wear it. That's what I'm saying. Some of these groups are really good, and some of them, uh-uh. Steve, Steve wants to know, do you have Cash App?
Do I have what?
Cash App,
Cash App?
right?
No. I don't know what that is, so no.
Okay, so Cash App is where someone can send you monies from their phone, and it
Oh,
goes into
okay.
your bank account.
Hmm. Weird. That's crazy.
So it may be something you want to download, because you never know what blessing is coming your way.
Yeah.
Okay.
Okay.
Especially if someone's asking, do you have Cash App? Meaning someone may want to send you something for the
Uh,
holidays for your children.
okay. I'll have to look into that and figure it out.
Yeah.
I mean, I've had people, you know, I'm very thankful for my grandma. You know, she gave me her kidney, and it wasn't for her, I probably wouldn't even be here right now. But you know, she is always so giving with us and with my kids and everything. She calls me every single day to see how I'm doing, and she's always like, "Let me know what the kids need." And you know, I always tell her, don't get anything. Like, we don't need anything, you know, because my kids have so many toys, it's ridiculous. They've had hand me downs and toys given to them and so many things like that. But you know, it's always hard for me, I guess, when somebody wants to give me something, because I don't expect anything from anybody. And I
Yeah.
have like a really hard time accepting things from people, because then I feel bad, I guess. So I don't
Don't
know.
don't feel bad. I'm the same way. I don't like accepting help. I don't like asking for help. But what I learned with the last 4 months, everything I've been going through,
Hmm.
it's okay to ask for help. It's okay to accept help. That doesn't mean you're weak or anything like that. We all need help every once in a while.
Yeah.
So if you have someone wanting to help you and your children, let them help you. Don't feel like, oh, they have enough this. They can never have enough. They're babies,
Yeah.
and this is from one mother to another mother. Accept the help any way that it comes.
Yeah. Okay.
Okay?
Okay.
Yeah, accept the help. So I want you to download Cash App, because you may be getting something coming your way.
Okay.
Okay.
And what do? You just download it and that's it?
So you download the app, and then you follow the instructions. I think you have to put like your bank information in. That way the money can either go on a Cash App card or go directly to your bank.
Oh, okay.
And you
Interesting.
never know when you're gonna need that money. You may not need it for toys, but you may need it for food. You get what I'm saying? Like
Yeah.
things come up, and you don't want to block your breath. So you don't want to block your blessings on because of pride. You get what I'm saying?
Yeah.
So
That makes sense.
I've been there. I'm telling you, I've been there. I almost got a little emotional, because I know how hard it is to accept help, and that's something I had to learn how to do. And on your journey, you're going to have to learn how to accept help, and
Yeah.
it's okay. Like, don't push help away. We all need help.
Yeah.
Okay?
Yeah, it's really hard for me, but I try. My fiance, he's always the one who's like communicating to people, and he always tells people like what's going on with me and my health issues and stuff like that. And then he's had people from his work give him toys for our kids and give us baby clothes when I was pregnant with our daughter. And stuff like that. And it always like means a lot. And it's like, if every chance that I can, if I know somebody who needs something that I have and I can help them, I always try and pass it forward, move it
Right.
along. So, like all my daughter's clothes that I had now from when she was a baby are all gone, because I've found so many people who were pregnant and needed clothes, and I was like, oh, here, I have tons of them.
Right.
But it makes me feel good to give something to other people, which I'm sure they have that feeling too. But
Right.
it's hard on the receiving end of it.
Right. Well, you gotta break some of that wall down so it's not so hard. And this is the pot calling the kettle, because I'm the
Yeah.
same way. Like I said, I recently had to learn how to accept help. I was never one that wanted to accept help from anyone. So
Yeah.
from one mom to another, just let that wall down a little bit to get the help that you need, because we are all struggling some sort of way. Okay?
Yeah.
Don't let pride get in the way of you receiving help, because you could block a huge blessing like that.
Yeah.
All right.
Uh, yeah, that makes sense.
Yes. So we're going to end our broadcast, and I still want you to download Cash App, and I'm going to text you again to download Cash App, and I will keep pressing you to download Cash App until you get it. And if you ever
Okay.
talk, you have my number. I totally understand. I'm not a kidney disease patient, but as a mother going through different health issues, I totally understand.
Yeah.
And thank you so much for joining us. Thank you for putting up with me with my nervousness. And
No, thank you for
thank you,
having me.
thank you on behalf of my awesome partner who I have grown to love so much this past year, Steve. We will see you guys next time. Oh, maybe I won't look so tired. The iron pills will actually start working. And thank you so much for joining us. We'll see you next week. Good night,
Yeah,
everybody.
thank you for having me.
You're so welcome, honey. Take it
Thank
easy.
you too.
Thank you.
Bye.